My name is Jessica Howard. I'm the site director for the Middlesex Centre Regional Medical Clinic, otherwise known as the Ilderton site in the rural regional program of the Department of Family Medicine. Here in Ilderton, we are about 10 to 15 minutes from London, Ontario, and we offer a good range of sort of urban, suburban, and rural population. Many of our patients come from London, but also the majority come from the surrounding community, so we have a nice mix of patients. Things that are unique about our practice, we have a teaching and non-teaching side of our practice currently. We have 3 physicians who are very experienced and have been with us for a long time, and they do take residents and medical students, but only one at a time. And then we have the academic side, myself and Dr. Van Dam, who have 2 residents and medical students with us at any time. At Ilderton, you'll have a chance to do a skin clinic with me. I do a skin clinic one half day a week in Exeter. Dr. Van Dam does emergency medicine in St. Mary's. Both of us enjoy doing a lot of procedures, and Dr. Van Dam has a special interest in cognitive behavioral therapy. So those are some of the unique opportunities at Ilderton.
So a typical day for a resident here in Ilderton is residents are booked with their own schedules. Generally for first-year residents, we'll start out with 4-month blocks where they will see at the beginning stages anywhere from 1 to 2 patients an hour until they get familiar. For their PGY 2-year residents, will be here for 8 months at a time, and we'll be working by the end of the residency. The goal is to have them working at a clip that a full-time practicing physician would be, so anywhere from 3 to 4 patients an hour. And that will be their own caseload. So we try our best to make sure that whenever possible, residents are seeing the same patients again longitudinally, get a good sense of continuity of care there, both for the resident and for the patient, and we find that patients really appreciate that.
As one of the main sites in the Department of Family Medicine, we have 4 residents at any one time, so that offers a collegial atmosphere, although it's nice and small still. The hope is that the program will grow. It's a 1-on-2 supervision with 1 staff and 2 residents. It's a nice commute, 10 minutes from London, and I think we're quite a relaxed site. We enjoy the work that we do, and we have a lot of fun. We're part of a family health team, so we have 1 family practice nurse who works with us, Sharon, and Jane, who fills in for her. We also have a nurse practitioner, dietitian, social worker on site, and those things make a huge contribution to our practice.
The relationship between the different interprofessionals here within Ilderton is very close. Actually, we work very closely with the nursing staff, with other physicians. While from a strictly organizational perspective, there are different teams within the clinic. From a more practical perspective, everybody interacts on a daily basis, and there's a lot of collegiality in that regard, a lot of working together in order to get the best outcomes for patients. We have regular lunchtime rounds where we discuss patient concerns amongst the groups to get different perspectives. And residents fit into all of those, residents and medical students fit into all of those areas very nicely. They're included right from the start in all of those meetings, and certainly the way the logistics of the building are organized, there's a lot of interaction between both different teams and residents from within different teams. So we feel it's a really good environment to foster a good, strong team relationship, which again is such an important part of family medicine.
I'm Clarissa Burke. I'm one of the part-time preceptors at the Ilderton site of the Western University Family Medicine program. And I have been here since about April of 2012, first helping to cover for the practice of Dr. Howard. So I haven't been here for terribly long, but it's been a wonderful experience thus far. Ilderton is one of the more rural sites of the Western program, but at the same time it's still very close to London, which means that it's been very easy for me to get back and forth, but to still have sort of that rural experience and that very small town, small community feel to the patients that I'm seeing and to the clinic itself. One of the nice things about this clinic is that the people who work here, the patients who come, most of them are a part of the Ilderton Clinic. And you can really see it, that people recognize each other when they pass each other in the hall, that there's always people socializing in the waiting room. You definitely feel that very much of a community sense. And I think that's something that's really nice about this site and a little bit unique compared to, say, some of the other larger sites in the London Urban program.
I graduated from Western in 2007 from med school, and then I decided to do family medicine at Western. I originally thought I wanted to be a dermatologist and quickly realized that family medicine was much more suited to my personality. I was really active in the residency program, and myself along with my husband we were the chief residents, and we really enjoyed being part of the Department of Family Medicine. And I practiced in Toronto for a year, and we were lucky enough to come back to London as faculty. In terms of my practice, I have a very young practice, and it's a lot of fun. I do a lot of prenatal visits and a lot of preventative health. I've kept on with my dermatology skills and running the skin clinic in Exeter. It's a referral practice, so other family physicians refer to me, and we do excisions of skin cancers. We do diagnoses of interesting, rashes and lesions, and I think the residents really appreciate that side of things.